Glad that you can join us for our daily briefing on the COVID-19 crisis. Today we'll hear from Governor Gary Herbert. He'll be accompanied today by Byron Russell, who is the co-chair of the Utah Multicultural Commission, and Nubia Peña, our director of the Utah Division of Multicultural Affairs. And following their discussion, we'll have our daily briefing from Dr. Angela Dunn, our state epidemiologist. And as we mentioned in yesterday's briefing, we'll be wiping down the podium between each speaker. Governor.
Thank you, Paul. This down here. Again, thanks, Paul, and thanks to everybody. Again, I'm honored to be here with you today as we talk about the challenges we face continually with the COVID-19 pandemic. And again, we appreciate the work of so many people. I don't think we can say thank you enough, particularly the people of Utah who, under difficult circumstances, are trying to comply with common sense behaviors to help us slow the spread, to stop the spread, to help us transition back to economic vitality and protect lives at the same time. So again, thanks for what everybody is doing. It really is encouraging to see the work of so many people stepping forward to do their part. So thank you. There's much reason to be optimistic. As we've mentioned before, we have the most comprehensive plan in America here in Utah. The work of many people, very bright people, medical advisors, scientists, data analysts, putting together this plan, which the good news, and I think you'll see some encouraging numbers again from Dr. Dunn today, shows that our plan is in fact working. It's having an impact in slowing the spread of this coronavirus. And along with that, there's some good news too, I think, that's worth sharing today. And that has to do with what's taking place with our business community. We know that they've been hit hard. I know it's on everybody's mind. How quickly can we get the economy back and humming like we had here a few months ago? And the good news is there's help. I've mentioned to you before about monies that have been provided for the federal government. But let me tell you a little bit about what the state is doing out of our GoEd office. Our small business bridge loan, for example, we just finished the evaluations on those who've requested monies and loans yesterday. Contracts are out today to be signed, and literally checks could be in the mail tomorrow for those businesses that have qualified. In our first round, we had 501 businesses that applied that have been approved loans. In our second round, we've had 648 small businesses that have been approved and have money underway. That amounts to about 15,000 plus jobs that are impacted by these small business loans. A total of 1,149 businesses throughout Utah in 28 of 29 counties. The one county that didn't have anybody that qualified, but 28 out of 29 counties have got participation with their businesses. A total of $12 million in loans going out then tomorrow. $3,667,500 is to rural Utah. So rural Utah is getting about 30.5% of the money. Again, this is designed to help people get through this rough stretch of road until we get back into the recovery mode, which is, I think, just a few weeks, a couple of months away. That's my own guesstimate. In addition to that, I talked to Howard Headley, who is the president and CEO of the Utah Bankers Association, to see how are we doing with the federal monies. And very impressive there, too. We're doing better probably than our population would warrant, because we've been very effective and efficient with our banks, local bankers, working with our businesses and filling out paperwork and making application in a timely fashion. But we have now 21,000 loans for small business in Utah, defined as 500 or less. $3.6 billion in loans, which are going to be coming here. We have 18,000 more loan requests from businesses in the queue. As you probably know, today they'll be voting on an additional supplement package, about $400 billion in Washington, D.C. And those in the queue, it totals up, they're smaller loans, but about $2.1 billion, which will be part of Utah's portion of that money. So again, good things are happening for our business community to help them weather the storm. And what we're doing on a federal level, what we're doing on a state level, and in conjunction, in combination with both the state and the federal government, we're helping our small business people to survive. With that, let me announce something that I think is a good news thing also. We care about everybody in the state, making sure that everybody has an opportunity to get through this challenging time. And so today I'm announcing the formation of a new branch of Utah's COVID-19 Community Task Force, and it's called the Multicultural Task Force Subcommittee. Today we're going to hear from Byron Russell, has been mentioned, who's the co-chair of our Utah Multicultural Commission, and also Nubia Peña, who's our director of the Utah Division of Multicultural Affairs, and she'll join us in this discussion about the goals for this new task force. These are uncertain and trying times for everybody, and probably all Utahns are feeling the pinch, but we have found by data that we have maybe some more significant challenges with our minority groups, some just because we have language barriers that are maybe in the way, and some cultural barriers, and we're concerned of making sure that they understand and get the information necessary for them to survive during this troubled times. And so the data that we have right now from our health department would indicate to us that there's a higher rate of infection amongst our Hispanic Latinos and also our Pacific Islanders. And so we want to see what we can do to remedy that situation. Under the direction of our Lieutenant Governor and the task force, this group recently underwent the process of putting together an extensive survey to find out how our minority groups, in fact, are doing and how these communities are faring at this particular challenging time. One of the things we're concerned about is, are they getting information on prevention, what they need to be doing to prevent them from getting the coronavirus? Are they getting stay-at-home guidelines and what they need to be doing appropriately? Job and housing projections, their unemployment issues, unemployment insurance, unemployment assistance, through workforce services. We're wanting to make sure that the information is getting out to all those folks, that the water really is getting to the end of the row. And we're concerned that maybe that has not been happening as effectively as it could. We've tried in many ways, just to give you an example, we've translated this information into a dozen languages. The fact that some we're not connecting with is causing us concern. We're going to help with the leaders of these different communities to work with us to make sure that people are getting the information and deliver this important message to their communities. This is going to need everyone to work together to make sure that we have information that's accurate being delivered to those who need to get the information. We've asked Nubia Peña, to the director of the Multicultural Affairs, to lead this task force subcommittee. She will be essential in making sure that we connect with these groups immediately, and that will help us to improve our efforts to make sure that they're safe and protected and get information which will help them with this emergency that we currently have, and help prepare them to rebound and have work and unemployment if in fact they've been laid off. This task force will include a wide variety of participation from such groups as government officials, business leaders, faith-based organizations, other community advocates, again, to make sure that we cover every sector of our communities and our minority groups so they get the information. The co-chairs will be Min Zhao, who's on our Utah Multicultural Commission, and also Byron Russell, who's the co-chair of the Multicultural Commission. We also have been working to reach out to other marginalized communities, particularly some concerns that we have with our Native Americans. Now, what we've done, for example, with our Hispanic group is that we've translated our daily COVID-19 briefings into Spanish so they can hear it and read it in their native language. We've translated to 18 languages already, and with 5 more on their way to come. So we're trying to make sure we have an outreach to those who can hear this and read it in their native language. Our Refugee Education and Training Center continues to provide services while maintaining appropriate hygiene and protocols of spacing to keep staff and the customers safe at our Refugee Education and Training Center. Since March 30th, they've assisted, in fact, 1,722 individuals speaking 62 different languages. And they hold regular Zoom calls with our refugee leaders to make sure, again, our refugees are getting information. So our minority groups, our refugee center, all working very hard together. And I appreciate the work. If people have questions regarding our particular refugees, you can go to jobs.utah.gov/refugees, and it'll give you refugee-specific information, and you can see what your concerns are, ask questions, and get answers. As I mentioned, we're working with also our Native Americans, particularly our Navajo Nation, which is our largest tribe here in the state of Utah. I've been in contact with President Jonathan Nez and also Vice President Myron Leiser about the unique challenge they faced on the Navajo Nation. They're in 3 different states. A large portion is in the state of Utah, one of our 8 recognized tribes, and trying to assess how best to serve their needs. And we're anxious to help them as best we can. And what we have done is provided mobile testing to the Navajo Mountain and Monument Valley areas of Utah. We've pushed out public health emergency preparedness funding to tribal programs that have applied for help and assistance, and also to the Urban Indian Center here in Salt Lake City. We pushed out legislative appropriation funding for tribal public health specific needs of the COVID-19, and all 8 tribes and the Urban Center have received help in that regard. We've also provided agricultural assistance, particularly for alfalfa and grain for the San Juan Southern Paiute Nation to help them with their agricultural needs. And we've provided much needed PPE, personal protection equipment, at the request of the respective tribes. Last but not least, we've provided food donations, hygiene material, and 7 800 megahertz radios to help support their instant command and their communication needs. So we've done a significant amount already. We look to see what we can do, and anxious to continue and even increase our efforts with our Native American brothers and sisters. So with that, that gives you at least an indication of what we're doing and some of the changes we're making to make sure that everyone in the state of Utah within our boundaries is being reached, given good counsel, advice, and giving help and assistance. And we appreciate the collaboration and cooperation we've received from so many, and I expect we're going to continue to do this even more effectively in the future than we've done in the past. So with that, we'll have an opportunity now to hear from Byron Russell, the co-chair of the Utah Multicultural Commission and the co-chair of this new task force that we're starting today, this subcommittee. And he will be followed by Nubia Peña, the director of the Utah Division of Multicultural Affairs. Now, Nubia, you should know, is in Philadelphia today. With the wonders of technology that we have today, she will be able to communicate with us. She's doing some work there with her family right now, but still working with the state needs here remotely. And she will join us via Zoom call. So for those watching us here in the presentation room, we will be able to hear her, but unfortunately, we won't be able to see her. So this will be a good opportunity for us to understand more about what this new task force is going to be able to do for us on behalf of our minority groups. And so we'll have Paul come and clean the podium, and then we'll have Byron come in and speak to us first.
Well, thank you. I wanted to give the governor a hug, but he said I couldn't. So instead, I can just say thank you, Governor Herbert, for your leadership during this time and this COVID-19 crisis, and for seeking oriented solutions that approve the equity within the Utah Leads Together plan, which you've created. I also want to thank Lieutenant Governor Cox for asking us to create the Multicultural Subcommittee of the COVID-19 Community Task Force, its official name. I've had the honor of co-chairing with the Lieutenant Governor and the Utah Multicultural Commission, comprised of an extraordinary amount of leaders serving the mission to promote an inclusive climate for Utah's diverse communities. Members of that commission will serve on this subcommittee along with community advocates, faith-based organizations, and key partners in government and business who directly work with the underserved and multicultural populations. While the COVID-19 virus can infect anyone regardless of nationality, income, or creed, data is showing a greater impact on minority or low-income communities. This subcommittee has been assembled to address those disparities, with an emphasis on recommendations from a survey that the governor just mentioned, conducted by the Division of Multicultural Affairs. The top priorities will help provide basic needs to communities where the crisis has compounded existing challenges, disseminate information to historically underrepresented communities statewide, and create a language and literacy access plan for this crisis. We will soon announce the complete subcommittee and membership and resource partners, but for now, I am honored to echo the governor's recognition of our co-chair of the subcommittee, my fellow multicultural commissioner and friend, Zeman Zhao. And now, I'd like through technology to introduce Nubia Peña, a most respected leader to lead this subcommittee. Nubia Peña is the director of the Division of Multicultural Affairs. Nubia?
Thank you so much, Byron. It is a pleasure to join you through Zoom, even though, again, I'm not able to join physically. It's incredible what we can do together when we have concerted efforts to move forward. I want to begin by thanking Governor Herbert and Lieutenant Governor Cox for asking us to lead this important subcommittee. This pandemic has forced us to consider the impact on marginalized communities and determine the most effective ways to ensure that they are not disproportionately harmed. To establish a baseline of service and identify gaps, our division conducted a survey of those working directly with underserved communities. Our findings showed that many people in these communities are worried about their basic needs, including food, housing, and employment. If they do get sick, they have limited healthcare options, especially if they do not speak English, do not have benefits, or if they live in rural areas or on tribal lands. A majority of our respondents identified language barriers in accessing services related to COVID-19 prevention and resources. Misinformation is also a primary concern, especially in relation to our undocumented communities as it relates to immigration enforcement and guidelines for social distancing and stay-at-home directives. Access to computers and technology was also a critical barrier because libraries, schools, and other places with computers or public internet are temporarily closed. We also found that rising concerns exist about intrafamilial abuse and lack of services to address the increase in survivors seeking resources. Now, due to our limited time, I invite you to download the full report, which will be found on our website. Our subcommittee will use the data from the survey and other resources, such as the health department, to most effectively get the necessary information to our multicultural communities. We are ready to work with the governor and lieutenant governor to tackle these issues head on. It will take all of us to ensure that none of us are forgotten, and we look forward to supporting our state leaders in advancing efforts that promote inclusion, equity, and human rights so that we emerge stronger from this crisis together. I would also like to note that we have up-to-date information on our website that is also linked to the coronavirus website that is showing where all of the available testing sites will be with Spanish translation. Our leaders are actively trying to make sure these resources are available for our communities, and we're excited and very much looking forward to supporting this effort for our entire state. Thank you again.
off. Thanks to Byron and Nubia. We appreciate your leadership and what you're going to be able to do with our expanded role here and making sure that our minorities in the state of Utah are being reached. With that, we'll open it up for questions before we have Dr. Dunn come in. Any questions we have?
Hi, yeah, my question is for the governor, and it's in regards to the Healthy Together app that was launched yesterday. And I'm curious, how has the response rate within the first 24 hours been?
I don't know if, Paul, have you got any numbers on that? 15,000? Only 15,000 in the first 24 hours. So that's good. And again, the more people participate, the better it is for all of us, and particularly for the individual that's participating. So that's a hopeful sign. Next
Thank
question.
you.
Thank you.
Hi, Governor. It's Rudy Nieves with Telemundo, Utah. I have a question about this special task force. So I've been hearing, I was listening that we're talking about we're going to give more information to the minorities, and we're going to also do some surveys. But I don't see if this new task force is going to do a special project or a special, I don't know, movement to help those kind of problems like access to health, access to information, and all that stuff.
Well, it's just formulated now, so they haven't made any determination yet as far as what to do other than make sure that we do something. So I'm going to have Byron, and then maybe Nubia could respond to that question. Nubia, are you still there?
Absolutely, sir.
Okay, let's have Byron and then Nubia.
Thank you for your question, and thanks for listening in today. What you've asked is very important to us, and you are part of the community who we want to hear from to help shape our policy and to help shape the ability for us to really make sure that the amazing efforts that are going on day in and day out 24/7 with the state are complemented by the resources like yourself who can help us to best understand how to navigate and how to communicate and how to address every single one of these gaps that are missing. And so I want you to stay tuned, and I want you to continue to stay involved with the links that Nubia had mentioned, because we will really, really depend upon your input to help us complete a complete picture for the state of Utah. And so please stay tuned, and we'd love to be able to take your recommendations as need be.
Thank you.
Nubia, go ahead.
Thank you so much, Governor Herbert. So I just wanted to briefly add that a lot of the efforts that will be developed by this subcommittee will be influenced by the people on the front lines that understand the gaps. So whether that is having individuals that speak multiple languages to help provide resource navigation, we are mindful of the gaps that exist. And so we are looking to see how we leverage resources amongst these partners to ensure that our community's needs are being addressed. So absolutely, thank you for that question, and continue to reach out to us. Thank you.
And muchas gracias to Telemundo for helping us spread the word and get the information out there. Next question.
Hi, my question's for the governor. I'm wondering about our considerations being made for the minority groups when we're talking specifically about reopening the economy. Since we have seen that some of these groups have been disproportionately affected by COVID-19, are you worried that that will continue as the economy reopens and we're, putting lots of people back into the workforce, back into the public in the open? And then secondly, with the Public Health and Economic Emergency Commission that is advising about reopening the economy, I noticed that there are no members of ethnic minorities on that commission. So how do you plan to, bring in perspectives from those minority groups, specifically with regards to reopening the economy?
Well, thank you. One, I believe that a rising tide raises all boats on the pond. And so as the economy recovers, obviously everybody will have an opportunity to participate in that recovery, and we'll get back to where we were before. We are down to 2.3 unemployment rate here just a few months ago, the lowest in our state's history. And so everybody really had opportunities to find work and have a good paying job and support themselves or their family. We want to get back to that same situation. We are concerned about making sure that nobody falls through the cracks, particularly our minority groups, and that's why we formulated this task force. We also understand that it's not just a matter of having jobs that are out there that are available, it's also making sure that people have skills and qualifications for the jobs that are in the marketplace. That's why we've made such an emphasis on education. That's where you get your skills, whether that be in public education, going on to university, or public education, going on to trade schools. We've developed apprenticeships and internships where people can learn different skills in different ways. So there's something for everybody out there, and our task force will help guide us as far as what we need to do in this recovery to make sure that our minority groups do not fall through the cracks. But as we recover, as we grow the economy, there's going to be jobs plentiful, as we've demonstrated here just a few months ago. Next question. Francisco?
Hello, Governor.
Yes.
I wasn't sure if I was being listened. Francisco Vasquez here from Univision 32. Governor, families with mixed immigration status, where one of the members of a family doesn't have a legal status, maybe yet, how can they get help? Is this task gonna help? Are you worried about families suffering of situations like this, where one member may not have a status yet, but all of the family members are American citizens and are not getting help?
I didn't quite understand. Are we saying that there's some people that are not getting help in a minority status?
With the stimulus check, since one member of a family doesn't have a status, for example, a couple, one of the members doesn't have a legal status yet, but everybody else does. Yeah. Are you worried about those families, and how can they help? How can they get help?
Okay, thank you. We worry about all families, and we want to make sure that every family is given good information to make informed decisions on what's in the best interest of them personally, for themselves individually, as well as for their families. Our workforce services people are trained to help all people, including our minority groups. They'll help them if they are unemployed, help them get skills if it's a skill set problem that prevents them from having a job and working. If they need some assistance, they have the ability to give them assistance through government programs. And so the place that they need to be going to, if they have, and everybody can have a unique situation, but the place to go is to our workforce services. John Pierpont is the director over there, and I don't know their direct number, but if you go to 538-1000, area code 801, 538-1000, and ask for workforce services, you'll be connected there. You can also connect them online for those who are looking for unemployment insurance, for example. There's so many people are doing that now. A quicker way to do it would be to online. Go to jobs.utah.gov, and you'll connect online. There is help there. There are people that care and that will work with you to make sure that you get all the assistance that you're able to get. Last question.
Hi, Governor. I'm wondering about the timing of this task force. I mean, we're we're over a month into this crisis. I know we just got, or at least the data was just publicly released last week about how this is disproportionately impacting minority communities. But we did see some data earlier on from other places like New York, for example, that showed that COVID-19 does disproportionately impact minority communities. Why wasn't this task force created earlier? And yeah, that's my question.
Well, like you've mentioned, things change in a hurry. We've always had disproportionate higher unemployment levels with our minority groups, which is mostly a reflection of lower educational achievement. We don't have as many people going on to post-high school education and getting skills. And for some of our minorities, they may be the first in their family to graduate from high school, which used to be enough, but today is not enough. So some things are a little bit lag in when we get the information. This has been a unique circumstance. We've been in free fall for about 2 months. And, we're just scrambling to adjust and to get our feet stabilized. And as we get through that process, which we've done, we find that some things maybe have not been as effective in delivery of messages and information as we thought. So we adjust as new information comes in. We adjust as fast as the information allows us to do under the circumstances. So it's not for lack of trying, it's not for lack of effort. It's as we've had new information come in, we see, we have a leak in the boat, so let's patch that up and move forward. And we're in a boat that's really being tossed to and fro by high waves and storm. So again, sometimes it takes a while to find out where all the leaks are. This will be the last. Oh, wait, do you want to say something, Byron? Byron's got.
I just wanted to add to that and the stream of questions with KSL beginning. You referenced some of the needs for economic well-being. And as the third phase of the Utah Leads Together recommends, and our survey suggests that there will be greater need to pinpoint those strains with our minority communities, our underserved communities, and those who are not necessarily at the forefront, but are certainly on the front lines. And so we are addressing that. And to the last question, I should mention that today's announcement is not a reaction. It's actually a proactive approach, but it has been something that we've been working on for about 6 weeks. And if you look at the survey that was put out, you'll see that it was very, very well thought out. There were 93 responses from leaders in our community, and we did our best to get those out in last month. And so this is not a new thing. This is something that we've been working on, and the Lieutenant Governor's office has been working with us almost, I hate to say this, on a daily basis. We've been talking to them, and we've been communicating for the last month. And so this announcement is the culmination of making sure that we have the right people in mind. And to the other question about DWS, we've asked John Pierpont to assign someone on this task force who can directly help with the questions that were asked earlier. And we also have someone from Zions Bank who will lead our diversity group, our diversity needs to those communities as well. So I just wanted to make sure that that was noted.
Thanks, Byron. Nubia, do you have anything you'd like to add in summation here?
Yes, sir. Thank you. I wanted to mention that on the economic task force, Sylvia Castro from the Pete Suazo Business Center has also been appointed. So the need to ensure that our communities are represented is definitely happening. And so we appreciate Governor Herbert and Lieutenant Governor for the support in allowing us to participate in these efforts. And at this point, we are ready to just start diving in, addressing gaps, and collaborating with state leaders. This is exciting because it's also a model for what can happen moving forward. So thank you, Governor, Lieutenant Herbert, and Lieutenant Governor Cox, and everyone that's supporting this initiative.
Thanks, Nubia. With that, let's invite in Dr. Dunn to give us the statistical report. Again, we thank you for tuning in and participating today. And I think we'll be back tomorrow. Yet to be determined, but we might have some good news tomorrow too. So thank you very much. Dr. Dunn?
Thank you, Governor. Thank you, Paul. All right. So we have 3,612 cases of COVID-19 here in Utah. That's an increase of 167 cases, or a 5% growth rate from yesterday. We've tested 80,627 people for COVID-19, an increase of 4,167 from yesterday, and we're at a 4.5% positive rate. We do have an increase of 13 hospitalizations, so a total of 301 people have been hospitalized for COVID-19 in Utah. We are at 35 deaths due to COVID-19. We are reporting one additional death today. It was a male over the age of 60 years, a resident of Salt Lake County, and was a long-term care facility resident prior to being hospitalized prior to his death. I want to update you guys on our incarcerated populations, what we've been doing in the cases we have identified there. We've had 45 cases associated with correctional facilities. 27 have been inmates, 18 have been staff, and it's all been in Salt Lake County. The Salt Lake County Health Department has been doing excellent work in working with our correctional facilities to address these cases and prevent further spread. Specifically, inmates are screened for symptoms consistent with COVID-19, and they're given personal protective equipment if they are symptomatic, and they're isolated immediately. All new inmates are quarantined for 14 days prior to being released into the general population, and inmates are monitored twice a day for signs and symptoms of COVID-19. Contacts to any confirmed case are quarantined according to public health recommendations. Employees of correctional facilities are using personal protective equipment daily, and they're being screened for fever and other signs and symptoms of COVID-19 at the beginning of every shift. And every correctional facility has heightened cleaning and disinfection procedures that they are implementing daily. So how Salt Lake County Health Department is working with the correctional facilities to protect inmates and employees is just another example of public health protecting our most vulnerable populations. With that, I'll take questions.
Thank you, Dr. Dunn. Chris Reed, St. George News. Quick question concerning the tracking, tracing, something that was talked about certainly yesterday. As far as people who are not using social distancing and those who are, is there a way you're able to track and trace those who do and those who don't? In other words, are you able to tell they didn't do the right procedures, they didn't do social distancing? Are you able to quantify that?
So in terms of close contacts of confirmed cases, public health is responsible for doing active monitoring of all those close contacts who should be quarantined. So we check in with them every single day and talk to them about the importance of quarantine, make sure that they don't have any symptoms consistent with COVID-19. In terms of tracking the specific movements of individuals, whether they're in quarantine, isolation, or the general public, in public health, we are not doing that. But we do know that from, for example, traffic patterns and other indicators that social distancing is happening and people are moving around less and tending to stay closer to home.
And to follow up on that really quickly, and one of the reasons I brought this up is, let's say events that are still taking place, protests, things of that nature. Is there any way you're able to say, well, it looks like this pocket came from that particular protest or something of that nature? In other words, are you able to, to quantify it that way?
Yeah, so when we identify any confirmed case of COVID-19, we go through their history and identify where they potentially were exposed. And so we are able to identify specific common locations across confirmed cases if there happens to be one.
Thank you.
Hi, Dr. Dunn. This is Jacob Kloffenstein from KSL.com. I was wondering about the pending purchase of the 200,000 hydroxychloroquine treatments. There was a statement sent out from the health department a little while ago. I was just wondering if you could clarify that a little bit. It sounds like it's still a pending purchase. Does the health department still intend to buy those at some point, or are you just waiting to see? Or I guess what's going on specifically with that purchase at this point?
Sure. So I am aware that our agency did put out a statement this morning, but I did not have the opportunity to review it. So I would just refer you back to that statement.
Hi, this is Sonia Hudson from KUER. I had a question about a bill that the state legislature passed today, and if the Department of Health had any thoughts on it or were involved in it at all. It provides immunity to businesses if a patron gets infected with COVID-19 there and tries to sue the business over that. Does the health department have a position on that bill?
So we haven't taken a position specifically on that bill. Our executive leadership has been in discussion with all elected officials to inform them of best practices so that they can make good policy decisions. Okay, perfect. Thank you guys so much for your time.
That will conclude today's briefing, and we'll be back tomorrow at 1:30. Thank you.
Thank you.